Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Hope everybody had a great weekend and enjoy the tremendous weather here in Rhode Island. It's another hot, steamy day today. A little too hot, steamy. John Giorgi only gives the day a 6 because of the humidity. But this weather is supposed to really continue throughout the week, so it's a great time to be outside during the virus. Other news, if you haven't seen the headlines, there's a number of breaking stories on GoLocal. Check those out. There will be no press conference by Governor Raimondo today. She has shifted, as I think we've reiterated, just to Wednesdays at 1 o'clock. Let's now go to Dr. Michael Fine. Dr. Fine, how are you today, sir?
I'm great, thanks. I had a great weekend. Hope you did too.
Yes, absolutely. The weather has just been tremendous. Though my tennis game has left we've got to switch sports again, find a sport that we're competent in. Let's go to the numbers. There was some significant news this weekend. Let's go through two things that broke Friday and Saturday. First, on Friday, GoLocal was first to report that a breakout had taken place at Bannister House, a nursing home in Providence, Rhode Island. Somewhere between 25 and 29 cases. It's almost all the new cases that have hit a nursing home in the last few weeks. Those numbers have not been updated since Friday, so we don't know if those numbers have continued to increase. And then on Saturday, Rhode Island DEM officials announced that a person working at the Scarborough snack bar tested positive, could not give a number of customers that individual had come in contact with, but urged people who had purchased there to get tested as quickly as possible. This virus has not gone away, sir, has it?
It has not. We are continuing to see numbers creeping up slowly, but it has not gone away. And in some communities, it's actually in fairly wide circulation.
So let's talk about that. The weekend numbers are out. Obviously, the weekend numbers have a couple limitations. One is that there's not a tremendous amount of testing. Also, the numbers always seem to get adjusted later in the week or the following week. So what the numbers are today may not be the numbers in perpetuity. But let's go through what the new Rhode Island numbers are.
Well, the biggest number, I think, is that the hospitalization number has continued to increase now for about 7 or 8 days in a row. We're up to 71 hospitalizations, which is not anywhere near as bad as we've been, and there's no push on hospital capacity. That's a good thing. But the trend is concerning given the trend of what we know about some of the other numbers and some communities and new cases. So I think we've got to really watch out now and use all our energy to make sure people stay masked and socially distanced. As I said, hospitalization numbers are up. ICU numbers are basically double from where they were about 5 days ago. Again, small numbers, so the statistical significance of them is not great, but the trend continues to be just a little bothersome. Really just 2 deaths over the weekend, thank God. We're at 1,004 deaths altogether, but I fear that the number of deaths will climb a little bit if it is getting in a nursing home and as the number of hospitalizations increase.
Yeah, those ICU, we've talked a lot about ICU and ventilator numbers. They were as low as, I think, 3 or 4 statewide, which was outstanding. And they're still functionally outstanding, but they've creeped up to 8. We're not going to publish a headline that says 100% increase, but it is the wrong side of the trend, and you liked it. I think everyone likes to see it in those low single-digit numbers, and would love it to someday be 0.
Yeah, and I think that's what we need to be working on. I mean, the summer is the moment to smash this virus back into its corners, to make it retreat as much as humanly possible. And I got to tell you that I'm not convinced we have won the peace. We'll see over the course of the next few months, but I expect things to get more challenging when schools come back and more travelers come from other places, and when people can't be outside very much and spend time together in the fall.
Yeah, much of the rest of the country is still seeing a record number of new cases, record number of hospitalizations, the number of deaths. I think we're 4 consecutive days over 1,000 across the country. California, Texas, Florida continues to see these just alarming number of new cases. Some of those folks are going to come back to college here in Rhode Island.
Yeah, and remember, it's not cases that are the problem. And I think what you're starting to see is the political world is discounting the number of new cases, and not so much worried about the number of people sick, because it's not putting any pressure on them. So at a certain level, it feels like we're letting this virus run its course, um, for better or for worse. The question is how it impacts our sense of trust and how it creates fear among the public, because I think the more fear you get, the more caution you get, and the poorer our social interactions are. And it's social interactions, it's trust, it's connectedness. That's what we mean by health. And so, in many ways, we are losing purchase on health itself as we get intimidated by this virus that is moving through the population and is being very difficult for few people, though is well tolerated by most.
Um, the death toll in the United States is edging towards 150,000. Um, the number of hospitalizations in many of these southeastern, southwestern states, generally the hospitalizations, some portion of them, translate into number of new deaths. Um, where do we see any light at the end of the tunnel that these bigger states that are seeing these sparks in growth, are going to begin to level off at any time?
Well, they probably will level off. I think what you see is the spread of disease is a function of the social distancing or lack thereof. And as disease moves into a community, I suspect lots of people start protecting themselves, and that's where you get protection against disease spread. So they're going to level off as we did. Um, and for them, the question will be, as it was for us, okay, when will it come back, given that the natural human impulse is to, be careful for a couple of weeks, and then when you see less disease, drop your guard. So I think we're going to see ups and downs in various parts of the country, and more or less commitment to care and masking and social distancing, and disease sort of ping-ponging from place to place based on who's doing what in what part of the nation.
Yeah, I'll tell you what, still in Rhode Island, drive down any coastal community, drive down the street, you just see maybe 30, 40, at best 50% of folks in fairly close quarters wearing masks here in Rhode Island right now.
Yeah, well, I think that's where we're at, and that's where I'm guessing that our numbers are going to continue to rise. I don't see the rigor, um, in our public communications around the need for masking and social distancing that we saw in the middle, at the end of April and the beginning of May, when it was the thing that kept us from having more trouble, to the extent we were able to protect ourselves. Um, I don't see the amazing effort at tracking down every single person and getting them into isolation quickly, and I don't see an amazing effort to look very hard at communities where there is still spread and bring lots more resources, and that to me means we're going to get a resurgence.
Yeah, Dr. Vine, many people know you as a physician in the community, innovating healthcare, as director of health. Less people know you as an author, and now you've launched a podcast. Talk a little bit about the podcast.
Well, actually, you're talking about my first love. which is fiction, writing short stories. So the podcast is one short story a week um, that's available on podcast, so people can hear it as they walk or run or drive. Sometimes easier than picking up a book or reading something online. Podcasts are they range in subject from uh, somebody who's dropping the biggest tree they've ever seen to someone who uh, is living on Kennedy Plaza and discovers that Social Security has has declared that they're already dead. Lots of different kinds of stories, um, but I think stories that help people's imagination uh, be vivid at a time when I think it's the imagination that's keeping us all alive.
We'll have all the links as where people can download those podcasts. So we'll have those up later on the site, and people can connect to that and download, and then and give some feedback. Talking about fiction, Sinclair Broadcasting Group, one of the largest owners of local television stations in the country, had a segment that they were going to run across the country that had an attorney and a somewhat discredited scientist who had taped a broadcast, and they claim that Dr. Anthony Fauci was responsible for the creation, the invention of the coronavirus, and that it was intentional, and that he was the one to blame. Other media companies brought attention to it. GoLocal wrote about it. There's a copy of the segment on our site, and they've backed off that they will broadcast it in the structure that it's in, but have not backed off broadcasting it at all. And this is what the country's kind of battling with, right? This reality of science versus these sub-realities of politics.
Yeah, actually, the podcast is called Alternative Fictions to sort of balance off the notion of alternative facts. We are hallucinating about a lot of stuff, and somehow these strange hallucinations have made their way into legitimate public discourse. We can't live like this. We've got to figure out what's real and what's not real, or before what's real comes and consumes us. Remember, this pandemic, as painful as it is, this is the softball pitch. This is the warm-up. This is not the bad one. The bad one is out there, coming at us one day. Maybe not next week, maybe not next week, maybe not next year. This is our opportunity to learn from experience and be ready for something more severe. This is our opportunity to develop ourselves as a people so we're ready to see things as they are and respond to them in a way that takes care of everybody.
Go ahead.
Go ahead, please.
Do we allow fear to take over us? The only thing I can think of in recent last 100 years of American history was McCarthyism, where a U.S. senator claimed that slews of people had infiltrated Hollywood, the Foreign Service, the U.S. military, and many of these things claim that they were communists. Many of the claims he made were that they were communists. He made these over and over again. He chaired a special committee. This became a national witch hunt for years. This wasn't just a 3-week segment. This went on for a couple of years before he was discredited. Is it we just can't handle the fear? In that case, it was communism and what the potential was to affect the American way of life, and this is our new McCarthyism.
Yeah, no, I think that's a real thing. I mean, in the setting of fear, somebody profits. And actually, if you look at what's happening during this pandemic, it looks really clearly like the rich have gotten richer and the poor have gotten poorer. And somebody thinks they're making money doing this. And that's kind of what drives the fear. It's not just fear itself. It's fear driven by self-interest. And what we as a people haven't done is looked self-interest right in the face and said, if we keep proceeding along the notion with the notion that society is best served when everybody fights for their own interest, then essentially we become a society at war and one that can't deal with challenges that are thrown at us by biology and by nature. Um, we've just got to do better than this.
Dr. Fine, what should people be paying attention to? Keep an eye on these numbers, keep an eye on what's going on at the nursing homes. Are we at the beginning of a danger zone, or hopefully is this just a temporary up and then back down?
I don't think we'll know about temporary or not temporary till it's over. And that means we proceed with an abundance of caution. That means, sort of do what you need to do, which is mask and, at the first symptom, get into isolation and social distance and be cautious. This is the moment, in my view, there's enough virus in circulation where I think it's actually probably not safe for people over 60 to be out in at least some communities. This is the moment for people who are over 50 or over 60 to make sure that they're staying safe and home in spite of the beautiful weather, fighting off that normal instinct to go and do things that are outside and, and go to the beach and so forth. This is the moment to be most careful, because this is the moment when everybody's guard is down and we're likely to get gobsmacked when we're least thinking about it.
Well, listen, we went to the beach late yesterday. Couldn't have seen a more incredible sunset in Rhode Island as what was enjoyed across the state. It was a reminder yesterday, and I'm sure again today, of what a special place we live in, that you can be in Providence in 1 minute and 45 minutes later on one of the most beautiful beaches in the country. That doesn't happen in many places in the world. Dr. Fine, I want to thank you so much for joining us. For everybody else, stay tuned for some updates on GoLocal. Some are quite significant. Also, I want to remind everyone, please wear their mask and please stay safe. Thank you.
Thanks, Josh.